Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Doctors at Upstate have performed more than 500 living donor kidney transplants, which is a major milestone for the program that started in 1968. Today, I'm talking with Dr. Reza Saidi, the director of Upstate's kidney transplant program. Welcome back to the Informed Patient, Dr. Saidi.
Thanks, Amber. Glad to be with you.
What percent of the transplants done at Upstate are from living donors compared with deceased donors?
In the past couple of years, we put emphasize on live donor kidney transplant because these are just the best options for the patients and they have the best outcome. And we're able to increase those numbers now to 1/3 of all kidney transplants done at Upstate are from a living donor. Despite the fact that those numbers actually are slightly down in the country. In the country is about 20%. But for the past couple of years, we increased it to more than 30%.
I was going to ask you how it compares with other transplant programs. It sounds like we're doing a little bit better.
Yeah, compared to, national average, we're doing better. But still, there is some room to improve. And our goal is that at some point we reach to 50%, which is actually, I think that's the goal that we, established that next couple of years, we can increase that number to almost 50, half of all kidney transplant from a living donor. Because, there are several advantages of our living donor. One is you can schedule that operation and do it when the patients have the best, and optimal condition to go through transplant. And that's different compared to deceased donor. But those deceased donor became available, we have to, proceed. But for living donor, we have time to optimize patient condition and also make sure all the elements are on the right track and optimize them. That's one of the reasons that the outcome of a live donor kidney transplant is much better than a diseased donor kidney transplant.
Is 50%, do you think that's attainable?
Yes, I think that's achievable. Some programs in the country are even higher than that. There are some programs that are 2/3 of all their transplant from living donor. But that requires a lot of work, investment, and also public education, that people understand that this is the best option for the patient. People should understand that people can live a healthy life with one kidney. We have, the first successful kidney transplant was from a living donor. And we have close now to about the 70 years of data about that this, if done under appropriate circumstances, this is a very safe option for the patient. But we have to make sure public is educated about this and people are very informed about the donation.
Well, talk to me about, from the patient's point of view, when they're first told that they need a kidney transplant, compare the waiting times for a deceased donor versus for a living donor. I understand the living donor, that's the optimal option, but is the waiting list longer for deceased donors? How does that work?
Absolutely. That's another, advantage of a living donor, that the waiting time is much, much lower. The average wait time to receive a deceased donor kidney transplant in this country is about 5-6 years. And in the area that we live in, New York, is close to, 6 years. And, people, if they spend that long time on dialysis, that have some negative effect on their health. And to some people that cannot be a candidate for kidney transplant anymore. And just remember, there are 100,000 people waiting on the list to receive a deceased donor kidney transplant. And each year, about 6,000 of them will die because there's no suitable organ available. That's why there should be a lot of investment and programming to advance the field of live donor kidney transplant.
Can you tell us what your patients who need kidneys do in order to find someone who will donate?
We try to, educate all our patients about the value of a live donor kidney transplant and make sure they're educated and prepared to discuss it with their friend and family. And I would say in the past couple of years with the social media campaign, a lot of our patients were able to find a donor. They can put their story on their social media or a local newspaper or a church bulletin. And you were surprised that a lot of them find that there are people that even might not know them very well. They step forward to give them a kidney. And with these campaigns, actually, the number of altruistic donors that come forward that just want to donate to anybody on the list to be a good citizen, And with those campaigns, we were able to increase the number of altruistic donors in our program. Right now, in our program, about a third of all living donors are from altruistic donors that they don't know the recipient. They just want to help
Interesting.
somebody.
What percent are blood relatives or family members?
I would say that about a third of our living donors are family members, but two-thirds are unrelated. They're friends or even complete strangers.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Reza Saidi, the director of Upstate's kidney transplant program, about living donor kidney transplants. What can you tell us about the National Kidney Registry's paired kidney exchange? What is that?
Yeah, that's also, I would say a new innovation in the field. In the past, about one-third of our all donors were incompatible with the recipients. And there was no option for them to accept to find, another donor. And for a lot of patients, that was not an option. And in 2007, a family that had a similar situation, that the donor was not a match, they decided to invent this service that's called National Kidney Registry. For all the donors and recipients pair who are not matched, they can go on this pool and exchange their donors. And with that, actually, the number of, I would say, the live donor kidney transplant has increased in this country because this service is not available for incompatible donors. We started this program at Upstate 2023. This program actually started nationwide in 2007 and gradually actually growing. And right now, a third of all live donor kidney transplant done in the U.S. are through the National Kidney Registry.
So, if my husband needs a kidney and I'm willing to donate my kidney, but it's not a match, I can pledge it through this kidney exchange to someone else, and then someone else would give their kidney to my husband.
Yes, that's
Okay.
one thing that can happen actually at the same time. The other thing that is beautiful this program that you can actually donate in advance and get a voucher. And then when your loved one is ready to receive a kidney transplant, you can use that voucher and use the pool. Because and remember, sometimes the patient might not ready for transplant yet, but for wide variety of reasons, that donor want to donate ahead of time. For example, a couple months ago, we have a grandfather want to donate to his grandson, but the grandson is still not ready for transplant. We think that he still has some kidney function, but his kidney function was deteriorating. And we expect that the grandson going to need a kidney transplant 2 years from now. And then grandfather said, maybe in 2 years, might not be around or will not be healthy enough to donate. I want to donate now. And in 2 years, when my grandson is ready, he can use that voucher to get kidney transplant.
I see. Has it been in operation long enough to know whether there's a difference in the outcomes between donor recipient pairs versus the paired kidney exchange?
Actually, we have, as I said, this program started in 2007, and the outcome is similar. Whether or not your donor is a match with you or not, the outcome is very similar. And despite that now you're getting a kidney from total stranger, but you still can have a benefit of live donor kidney transplantation.
Okay. Can you explain what's done to match recipients to donors? Because I know it's more than just blood type.
Besides blood type, we also do tissue typing. Make sure that the recipient's tissue is compatible with donor, and make sure that the recipient doesn't have antibody against the donor. If those are present and that there's a mismatch, as I said, the best option for that patient is go through this National Kidney Registry program. And usually in a matter of a few months, we were able to find a suitable kidney donor for our patients.
Are there any support programs for people who want to donate their kidney?
There are some, but there are some limitation. For example, there's one program available nationally, but to qualify for that program, your income should be not more than twice of poverty line. But state of New York actually provides more support and also make it illegal that if somebody donates their kidney, the insurance company, if that patient wanted to receive a health insurance, they cannot discriminate against that person. And also companies operate in the state of New York. By law, they have obligation to provide, times off for that person, those kind of things. I think that's very important that not all states have this safety net. And that's, I think, one of the barriers to donation, because there are some hidden costs. For example, who's going to pay for your taxi or support when you come to the hospital, stuff like that. And a couple of years ago, we did a study, actually. If you donate your kidney, despite the fact that, the recipient insurance will cover some of your medical costs, but there are about 4,000 out-of-pocket costs that is not covered by anybody. Like, for example, you want to travel to that transplant center and stay in a hotel for a couple of days, something like that. But now in city of New York, has been very proactive to pass this law that basically can cover some of those costs, and I think that can increase the number of living donors, especially in the state of New York. But for other states that don't have those laws, and there's some discrimination against if you donate your kidney, if you want to get the insurance, those kind of things, that I think that's some barriers for some people to donate.
Does the donor have to have health insurance themselves?
No, usually the recipient insurance will cover the cost. Because remember, the cost of dialysis is much, much higher than cost of kidney transplant. That's why the insurance will cover, but they don't cover everything. They cover the medical costs, for example, hospitalization for surgeries, those kind of things. They will cover, but it's still there's some out-of-pocket costs.
That's got to be helping increase the numbers of living donor kidney transplants then.
Yes, I think especially in the state of New York, we see that. But as I said, in the nation, unfortunately, the numbers are down.
Now, what about after surgery? What is recovery like for someone with a new kidney?
Recovery, because after live donor kidney transplant, majority of kidney, they work right away because the kidney is out of body for a matter of a couple minutes. And this kidney work right away. The recovery is much, much faster compared to disease donor kidney transplant. But still, it's a big operation. And the average recovery is about, I always said 4 to 6 weeks for the patient who received a kidney transplant. On the other hand, the recovery for the donors are much, much faster because we implement the minimally invasive approaches to remove the kidney from the donor. And the majority of these donors go home the next day after the operation done to, small holes and laparoscopic surgery or minimally invasive surgery. And the full recovery from that surgery is usually about 2-3 weeks, back to normal, and they're back to work. As I said, we have about more than now 7 decades of experience doing this. And in long term, patient can live a healthy life with one kidney, and their life expectancy doesn't decrease after you donate one kidney. And the risk of developing kidney disease or other diseases usually is similar to the normal population. It's a very safe thing to do.
So if someone who is listening is interested in, an altruistic donation, they want to help somebody who needs a kidney, what are the steps they would take to see if they're even a candidate to donate their kidney?
At Upstate, we have a screening tool that is available even online, or you can do it via phone. And if you pass that initial screening, then we get some testing on you, make sure your kidney function is good. And after that, we evaluate the patient in clinic. And if that's all good and the patient have adequate kidney function and there's no concern, then we proceed with the CAT scan, make sure the patient kidneys anatomically are suitable for donation. And after that, patient can donate. Actually, we try to decrease the time that donor requires for evaluation. And right now, at Upstate, an average wait time to be seen and evaluated to get the yes or no answer is about 10 days.
Oh, that is quick. Let's assume that the person is able to donate and they go through with the operation and they're back to work and school and whatever in the next couple weeks after that. Do they see the transplant team again, or are they back to their primary care provider?
By the law, we're obligated to follow them for 2 years.
I see.
Follow them, make sure everything is okay. And after 2 years, they can go back to their primary.
Now, someone who receives a kidney, do they see you for more than 2 years in follow-up visits?
Yeah. If somebody receives a kidney transplant because they require special care, we usually, follow them for a long period of time. Some of them actually stay with us for the rest of their life because they have to monitor, because they take some medication to basically weaken their immune system to prevent rejection. And sometimes patients can have side effects. They have to be very closely monitored.
Well, this is very interesting, and it's encouraging that you've been able to do so many living donor kidney transplants and that you have the plans to do even more. So thank you for sharing that with us.
Yes.
My guest has been Dr. Reza Saidi, the director of Upstate's Kidney Transplant Program. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.